This conference will now be recorded.
All right, folks, so you'll see here as we're looking at chapter 12, the urinary system, this is what we're going to be focusing on today as far as for our lecture, looking at the urinary system. So you all that are online, you have this opportunity to look at what's going on here. I'm sharing this with you all on campus here. I've also given you copies today. Here we go. So one of the key issues to recall and to know, and as we review the urinary system, is to understand it's vital for life, okay? Just as all of these different systems of the body, right, work homeostatically via homeostasis, maintaining a stable environment inside the body, no matter what is going on outside of the body. And also to adapt to changes as far as whether we're exercising, whether we're at rest, whatever it is that we're doing, whether we're in crisis, right, stress, kind of thing. So the body will react, right? And we know that the body adversely reacts to stress, right? We get that. So, but thinking about the urinary system and what it does, folks, we're taking the blood. So here's just one model of a human kidney. We can see that right here. So we've got a kidney. We have the adrenal glands resting on top of the kidney. So as far as the adrenal glands are concerned, the inner portion of the adrenal glands, that's going to be releasing epinephrine, norepinephrine, or adrenaline, noradrenaline. Okay, we're understanding of that. That's the inner part, the medulla, the medullary part of the adrenal glands. The outer part dealing with hormones and such, okay, in the endocrine system. So as far as the kidneys are concerned, you'll see here at what's called the hilum. So this is the hilum where we end up having the blood vessels as far as coming and going from the kidney, and also this structure right here, which will become the ureter right here. This is the pelvis, the renal pelvis, and this is going to take the urine and drain it to the urinary bladder for when we have the opportunity to relieve ourselves, right, by urination, voiding, whatever term you'd like to use to describe. But you'll see here again that this model, and you'll see there this afternoon, those of you on campus here, that this model receives a lot of blood, okay? Filtering blood in order to form a filtrate, which will become urine, okay? So by filtering the blood, we're removing waste, we're removing water, and then we're going to reabsorb most of it, okay? But some of it is going to leave the body. So some of it will become urine, and that urine will travel via this tube right here, this ureter, to the urinary bladder. So take a look over here at this model, folks, that you are on campus. And you can see that the structures here. So as I remove these structures, you see that we have two kidneys. These tail structures right here, these tubes, those are the ureters. There's one for each kidney, and they drain into the urinary bladder, which is right here. So very important to know that we filter blood, we create a filtrate. This filtrate will primarily reabsorb most of the water, and then whatever's left over will be the urine that will enter into the urinary bladder. It'll be a storage area there waiting for the opportunity to void, and that will leave the body. So take a look over here on the PowerPoint here. So the chemical makeup of body fluid is constantly changing. And this is true, right? We have fluids present within the body, and what's making up those fluids, what's present within those fluids, is changing. That's not too hard, too difficult to understand. An adult body, 50 to 60% of our bodies are fluid. That's remarkable, right? That's very remarkable. And understand that the urinary system has a role in adjusting the fluid levels placed within the body. So have you ever seen someone who has had their lower extremities, like their lower legs, their feet, really swollen? We would call it edema, right? Really bad. And what's going on is that a couple issues here. Their heart's not pumping properly, okay? and also the ability for their kidneys to be functioning properly, their lymphatic system to be removing those fluids and such. This is all factors that can be involved in issues with the fluid levels that are out of sync in the body. This term here, extracellular fluid, it includes tissue fluid, so fluids that are surrounding and part of the tissues of the body. The plasma, the liquid portion of the blood. The lymph is that plasma that's been sucked up, that's been brought into the lymphatic system. Remember, again, the lymphatic system, it's a part of your immune system. Okay, it works in conjunction with the immune system of your body. So the blood vessels, right, with really the blood, the white blood cells and such, cardiovascular system working with the lymphatic system in order to look for anything, any microbes that could possibly make us sick and create some type of defense, an attack and defense. You'll see here cerebrospinal fluid. This is fluid that's present within the nervous system and that actually covers your spinal cord as well as your brain. Right? It acts as a little bit of a very like a cushion present within the nervous system. So cerebrospinal fluid, it's also produced by, it's a blood product, okay? So the liquid portion of the blood is that plasma. Here's just giving you just a rundown or an idea regarding how many quarts of body fluids are present, what's considered extracellular, what's considered intracellular, so outside of the cells or inside of the cells, right? And how we can then break it down as far as then seeing that there are other fluids that make up and comprise these different types of, we would say, fluids as far as extracellular or intracellular fluid. Outside of the cells, inside of the cells. A lot of fluid. Here you're seeing as far as the balance that's taking place throughout the day, right? So yes, we're taking in food, we're taking in liquids, right? And so what's taking place as far as material, that water that we're gaining and water that's leaving our bodies. And so there's really and so sometimes what will happen is if people will go on a diet, initially what they're losing weight, what's one of the key issues that they're losing is they're losing a lot of water weight initially when a person is on a diet, okay? Just so that you know that there. Now, in the extracellular fluid, the fluid that is outside of the cells, okay? You'll see here that there's a balance that's taking place. So the body takes in about the same amount of water as is lost, okay? And this creates this balance so that one day you're not 10, 20 pounds overweight. No, your body will handle this and make sure that there is this balance and that you will produce urine in order to, you're going to always produce urine, but might you produce more of it if you take in more water, right? Liquids, absolutely. You'll see here that absorbed from foods, liquids consumed, right? And look at this here where it says produced during metabolic reactions. So these different reactions that take place within the body, water can be a product. You can end up with water as something that is produced as a result of this reaction that can take place. And so this is common. Water deficit induces the thirst mechanism. Wouldn't this make sense that if you don't have enough water, if you're developing this deficit of the water that you should be having within your body, then your body is going to, your nervous system will let you know by, hey, you feel thirsty, right? And you want to get more water into your body. That's natural. How are we losing water? Sweat evaporation and through the urine and also through the fecal material, through your solid matter, there is water content. I don't know if you remember, within the large intestine, your colon, this is where you're absorbing. So the feces is passing through that area, that large intestine. Let's look over here. Take a look over here. So the gray represents the large intestine, right? Fecal material is present there. Now, what's one of the roles of the large intestine? Right? Well, it is a pathway for the solid material in your body. It's also an area where bacteria are present, right? That microbiome of these little microorganisms that help us produce vitamins, help us process, and also we're going to absorb a lot of water as much as possible from the fecal material in the large intestine. So yes, there's going to be water content, but not so much. Unless you're sick, right? And if you experience diarrhea, that's a way where you're going to lose more water, become dehydrated. This is why young kids, right? Children or adults that are really sick, what do we do? If they're taking if they're experiencing diarrhea, we'll give them lots more additional liquids. Pedialyte is one thing that they'll use that'll just help them create more of a balance as far as the water content in their body. So this makes sense. Urine releases excess water. Okay, so if your body needs to get rid of liquids, this is how the body does it. Okay? Know this, that if you are given a pill, right, a medication called a diuretic, this is a medication that will help you produce more urine. So a diuretic, right, this is a pill that can make you produce more urine, and if you produce more urine, you're going to decrease the amount of blood flow, the blood volume present within your cardiovascular system. If it does that, then it's going to also play a role in reducing your blood pressure. So if you reduce your blood volume, you reduce your blood pressure. So to reduce someone's blood pressure, we give them pills that are going to produce more urine, and they're going to relieve more liquids from their body. All right, let's see here. Most solutes leave by urinary excretion. So there are different waste products that are removed via the urine. Okay, products of protein metabolism. So these can be released. They can be excreted. They can be removed, voided, urinated out of the body via the urine. So urea, that term urea there, that's a term for waste products that are produced as a result of protein metabolism. Here, this next slide just gives us some information and gives us kind of a graph and a chart to just see as far as what's going on with the different products that we're taking into our body, whether it's food, whether it's water, right, food or liquid, whether it's oxygen, whether it's gases coming into the body, and how is the body handling them as far as what's present within those substances that we're taking in, and what do we need to remove from those substances to not keep within our bodies? Waste, right? Whether it's a gas waste like CO2, or a solid waste, right, or a liquid waste. So it's a cycle. The cycle, we're continually taking in new, and we're absorbing, right, what is needed for the body, and we're eliminating what cannot be used by the body. So the kidneys are this primary structure that we're using, that the body uses in order to filter the blood, produce this filtrate, which again, as the filtrate, we're removing the liquid from it and anything else that we need to remove from it, so that we're only left with the urine at the end that's going to end up into the urinary bladder and excreted from the body. So you see here that it has a capsule. It has a covering. So take a look at this model, folks. So let's pass it around to you. So pass it around the room. Take off the hat there, the piece there. Pass it around the table, please. So as you're looking at this bean-shaped organ, it has a capsule, an outer covering. Then if you look on the inner portion, you can see that there are specific structures here, and there are some that you'll have to know for the lab quiz. Okay, so that's on the on the list there for lab quiz number 2. And part of this structure, if you look at your model there, it's kind of beige. So the inner part here, and as far as also this structure right here, okay? So the renal pelvis is right here. This is where we're going to end up having urine enter into that large structure, that central cavity, and then it's going to be entering into the tube, those ureters, which will then take the urine to the urinary bladder. So kidney functions, what are some of the kidney functions? As we've looked at as far as with each of the different body systems, okay, we've looked at what's the function of the systems. So primary function for the kidneys, you'll see at the very bottom, remove metabolic waste. So remove waste products and adjust the fluid balance right here. That's important. So we filter the blood. We produce this filtrate, which will become urine. We're going to remove the bad stuff, the stuff that the body can't use, that's waste, and we'll reabsorb, excuse me, liquids, water, as well as any other solutes that are present within the urine that we want to reabsorb and reuse. See, the body does a lot to do what's called, we would say, recycle everything that we have within, okay? Even when red blood cells, right? So think about this, red blood cells, after a couple of months when they're no longer viable, then what do? The body will break them down and it'll reuse the components of the red blood cells to create new cells. Okay? So really important. Now you'll see these couple of terms here. So EPO, or erythropoietin, right? So this will help and aid in the production of red blood cells. And if we have an issue where the patient is anemic, someone is lacking in red blood cells, how about if they've had a trauma and they've lost blood, right? Well, then wouldn't it be a good idea for the body then to release this hormone in order to stimulate more red blood cell production? So this EPO, when you think about those athletes that were doing the cycling, that were doing the and they were cheating, what were they doing? Part of what they do is they'll do things like take EPO, right? They'll do things that will stimulate an increase in more red blood cells because that'll increase the amount of oxygen flowing through the body, or they'll actually take their, you recall this, I said this, that they'll take transfusions of their own blood right prior to the tournament, and then they'll have a higher concentration of red blood cells present within their body, which also can put them at risk for stroke, heart attack. But they have more red blood cells flowing, more ability to move oxygen to the tissue. As far as, yeah, so it's more of the amount that they're having more red blood cells. So if I have a certain amount of red blood cells, they'll release oxygen to the tissue to transport it. More red blood cells, that will increase the ability to send more oxygen to the musculature, which can the body, so it can help with the ability to perform better, performance enhancer. Right? So yeah, so they'll do EPO, they'll do blood doping and such, where they're taking transfusions of their own blood. Never a good thing. But EPO increases red blood cell production. Conversion of vitamin D. So, excuse me, 1 minute. How many of you have been to the doctor and they say they've done your blood test, right? They've done a blood test and they say, you're low on vitamin D, your levels. Many of us are. How many of us spend a lot of time, especially during the wintertime, out in the sun? Not a whole lot. But even during the summertime, people work and such, and so they'll have a vacation time. But primarily, unless your job is outside in the sun, your deficit of vitamin D is part of it as a result of the interaction between UV light and you and your body. Go ahead. So vitamin C also like more of a nutritional type situation. But vitamin D is one of the key issues there. Yeah, with that. Yeah. You'll see here renin. Renin also is a hormone, okay, produced by the kidneys, and this helps to regulate blood pressure. So if a patient is having low blood pressure and the body recognizes this, it can produce more renin, which will help to increase the blood pressure. So the kidneys are paired structures. There's two of them. Okay, bean-shaped, we get that. Lobes, different structures present within, and there are microscopic structures present that will aid in the filtration of the blood in order to form this filtrate, which will become urine. You'll see here that the cortex and the medulla. So there's an outer part and an inner part. So take a look at this model here again. And what you're seeing is that where these little red triangles are, that would be the medulla, the medullary, the inner part right here. The outer part is just this pink area. Pink area, that's the cortex. The inner part, where those triangles are present, that's the medullary region. That's the inner part. And again, that capsule is what's covering it. And the chamber, there's an area there, there's a hollow area that's going to receive the actual, see here, the cavity, the renal pelvis, that's what's going to receive the urine. I think I passed that up. Yeah, I passed it. Let's go back here. There we go. Now, as far as on a microscopic level, nephrons, there are more than 1 million nephrons. These tiny structures, these units, these tubular units that will allow for this filtration of the blood and producing this filtrate, which will become urine. Now, it's tubular. Let me show you guys here on campus. So take a look at this structure right here, folks, on campus. So you see this structure right here? These tubes? On a microscopic level, it's present within these areas of the cortex and the medullary region of the kidneys. Microscopic, this tubular structure. And what happens with that tubular structure, let me show you all here online. So this tubular structure, folks, right? This tubular structure is called the nephron, and it's going to drain the filtrate into this tube here called the collecting duct. So you'll see here, there are these other structures that will, I want to send this around the room again, and I want you to see that those red triangles, see the red triangles have kind of like those lines present within them? The line? Well, those are as a result of tubes, collecting ducts, that will receive the filtrate produced within these tubes, okay, of the nephron. So here's just showing you a little bit regarding these microscopic tubes called the nephron. They will be covered in blood vessels because we're going to take material out of this tubular network and put things back in. Question? Good. That are going to then, again, produce this urine. So the nephron. Many of them. Filter water and solutes, the particulate matter from the blood. Let's move this on here. All right, everybody stand for a moment, please. Let's take a look. We're going to look at this picture. Everybody just stand and stretch it out a little bit. Don't you get tired and sleepy while we're in class here for the next little bit of time that we're here. But so here, what you're looking at here is that you can see the kidneys, you see the adrenal glands, caps on top of the kidneys, right? On the superior aspect, the top area of it. You can see here that we have blood flow to and from these great vessels, these inferior vena cava, this abdominal aorta, a lot of blood going to and from the kidneys because, again, we're filtering the blood to produce urine. And then you can see these structures right here, these tubular structures called the ureters, draining urine into the urinary bladder. Okay? So these ureters draining urine into that urinary bladder. All right, folks, you can have a seat. And what you're looking at here with this one, this image right here, you're seeing that there's a capsule, there's a covering, there's a cortical or a cortex, and then there's a medullary region. And then we have this space here, this cavity, where the urine will gather and enter into the ureter to the urinary bladder. So take a look at this for a moment here. So what you're seeing here is that blood is coming to and leaving the kidneys via these great vessels, right? These large vessels. And we're having that filtration of the blood, producing the filtrate, which will become the urine. You can see that there's a lot of vascularity. So how about this? If someone gets punched in the kidney, right? They get punched in the kidney, or they get kicked in the kidney, you think it's going to bleed through the urine following days or couple of days or so? Kidneys are highly vascular, a lot of blood. So that's what's going on here. So you can see these pyramids. These are part of the medullary, the inner part. The cortex is out here in pink. Here's the cavity where the urine will be drained into and exit via the ureter to the urinary bladder, this tube. Now you'll see here that there's a term that we use. See the kidneys right here? They're next to, adjacent to the spine. And here would be the peritoneal cavity. This is where you have your abdominal and your pelvic organs. The kidneys are considered retroperitoneal. They're outside of that covering of the peritoneum. Do you recall I mentioned last class there when we were talking about the digestive system that peritonitis is the covering of an infection of the covering of the abdominal pelvic organs and such. So peritonitis is life-threatening, but you'll see that the kidneys are outside of that peritoneum, that covering of those structures. Here you're seeing as far as what's going on with the nephron. So this is a nephron, and it's composed of these structures. This term, glomerulus, it's a term that just describes that there's a grouping, a bunch of capillaries. So imagine, do this with your hand. Do this with your hand. So imagine that you have your fingers represent all these little capillaries, right, that are present and they're covered. Okay, they're covered. So there's a capsule, there's a covering of this capillary bed. And in this capillary bed, this is where you have the filtrate produced. You have blood coming to the kidneys. It's going to be pushing under pressure, and it's going to come out into this covering. So imagine that I have. So here's the glomerulus. This grouping, this knot of capillary, and it has covering on it. There's a covering on it. That's the capsule. Now, if that's where the blood is, and there's a covering of it, where's the filtrate going to go? It's going to go in this covering. So imagine this is a balloon, and it's covering the capillary bed. So what's going to happen to the filtrate? The blood's going to still stay within, but some of the liquid, a good portion of liquid, is going to come out into that balloon. And then that balloon is going to hold on to, the filtrate, and it's going to pass through these tubes. So you see where it says the capsule? This capsule is the covering of these capillaries. And so filtrate is going to be present within, and it's going to go into these tubes. You'll see here there's a closed tube, and there's a farther tube. And then this right here, there's a loop. Simple enough. Let's go back here for a moment and just take a look. So you'll see, let's look at this. So here, folks, this would be the glomerulus with its capsule, and here is a tubular network. Okay, so a closed tube, a proximal tube, a distal tube, and here's the loop. So those of you on campus here, take a look at this image again. So here is that glomerulus, that capillary bed, right? It's covered in a capsule. It collects the liquid, which is the filtrate. It enters into the proximal tube right here, the closed tube. It goes down through the loop and then goes out into the distal tube, further away, right? More distant from the capillary bed. Well, what happens in this tubular network is that those of you online, you can see that we have some blood vessels here covering it. Folks, there are blood vessels that will cover all of this tube, all of these tubes, and they will reabsorb, right, solutes and also water from the filtrate. And they'll put some things back into the filtrate, which will then eventually become urine. So these collecting ducts, that's what gives the lined type appearance of those. See here? See how you see those lines? That's as a result of these tubes that are receiving all of this filtrate that's going to become urine. Okay? And what happens, folks, is that urine is going to drip out of this little tip right here. See the end of that? Let me show you here, folks. You know, there's lines in this pyramid. It's a pyramid. It's an upside down pyramid. Well, urine is going to drain out of holes in that structure right here. This is that medullary, that inner part of the kidneys, having these tubes present that are going to allow for urine to drip out of and into that pelvic area there, that cavity area. See this cavity right here? Let's see here, right here. See this cavity right there? That's where the urine is going to be caught by that dripping of the urine. So all in through in here, this pelvis will receive the urine. Show you here. So these structures, these pyramids, will drain the urine right out of these little apex of the pyramid here, and it's going to drain the urine here and then down into the ureters, going to the urinary bladder. Again, a lot of blood is coming to the kidneys and coming to those nephrons. So we have capillaries. Now, this is a unique situation where we have an arteriole bringing blood to the capillary bed and also draining the capillary bed. Now, next slide here. That's not as much of an exciting thing for you, but just understand that these arterioles normally just bring blood to a capillary bed, and then venules, the veins, part of the venous system, will drain the capillary bed. In this case, it's different. Now, look at this next item here with this slide. 3 steps of urine formation. So I said to you that first we have to filter it. We filter blood. We reabsorb most of the water, and then we're left with secreting anything that needs to go out of the body. It enters into the filtrate. So write that down for me, please, those on campus. Filtration. We filter the blood. Filtration. We filter the blood. That's in the glomerulus. We filter the blood. That's in the glomerulus. That knot of capillaries, right, covered in the capsule, that's where we're filtering the blood. So filtration takes place first. Reabsorption. We're reabsorbing nutrients, most of the particulate matter, most of the solutes, and water, primarily water. So you're reabsorbing water, nutrients, and other solutes, we would say, the term solutes. S-O-L-U-T-E-S. Solutes, particles. Secretion, we're actually going to allow for then material to go back into the tubes and become the urine that's going to be relieved out of our body. So we're secreting waste, secretion of waste, and a little bit of water. That's going to become the urine that exits your body. So we're filtering the blood, reabsorbing nutrients and other particulate matter. But the big deal here, we're reabsorbing most of the water. You're reabsorbing most of the water. And you're secreting only a little bit is going to be staying within those tubes and become the urine. Okay. So filtration is pretty easy. You're just filtering the blood. The liquid portion of the blood is what is becoming that filter. Now, if you start allowing for cells and different larger particles entering into your urine, so if they say to you that you have proteinuria, you have proteins in your urine, not a good thing or a bad thing? Not a good thing. Because it's given us an indication that there's something going on with your kidneys, that you're allowing for these big particles to enter into your urine. That's not a good or a healthy thing. Reabsorption returns the useful substances to the blood. So those blood vessels that are covering the tubes of the nephron, so those blood vessels that are covering the tubes of the nephron, right, they're reabsorbing liquids, useful substances like those particles, nutrients. We're keeping those. So glucose, amino acids, the building blocks of proteins, electrolytes. These are all important to be able to reabsorb and contribute to the function of the body. Secretion. This is where we're actually then allowing for waste to leave the body as urine, right? So this is where we're going to actually then put substances back into the tubes so that those tubes can take that urine out of the body. So secretion ensures waste and foreign substances do not build up in the blood, and that's a good thing. Okay, so it's quite remarkable that your blood is being filtered on a regular basis throughout the day, and it happens quite a few times. So take a look at this image here. You do not have to memorize this, but just to show you what's going on as far as, here we have filtration at the glomerulus. It's a capillary bed. Blood vessels, right? An arterial, a small artery, is bringing blood to and taking blood away from, that capillary bed. You see the outer area here? That capsule, think of it like a balloon. It's accepting, it's receiving the filtrate produced by that filtration of blood. And then you can see that we're reabsorbing ions like sodium ions, chloride ions, potassium ions. Very important for the function of many body systems like the nervous system, like the muscular system. right? Very important. By these capillaries, by these blood vessels covering the tube. And then we're sending back in water and such. And so water is going to move back and forth, but primarily we're reabsorbing most of the water. And so when we get to the part here, the collecting duct, this is where we're just going to then allow for this urine with its waste products to leave the body. And you're seeing here very simplistically that we have the closed tube called the proximal tube, we have the loop, and we have the distal tube, that further away tube, that's going to then take this filtrate, which will then, once it's in the collecting duct, become urine and leave the body. This next slide here, I just want you to see as far as, so amount filtered. So 180 liters is filtered. 180 liters. That's the filtrate that's produced. So think a 2-liter bottle of soda, right? Times 9, you're looking at 9 2-liter bottles of soda worth of, right, of filtrate that's produced. And we reabsorb 99% of it and only a percentage of it, 1%. So a liter or 2 is actually going to be urine that's going to leave your body on a daily basis. Urination. This is a controlled action. We get this, right? We understand this, but does anybody have younger brothers or sisters, like really young? Does anybody like potty training? Or how about like nephews or nieces or people, you know, grandkids, right? So I have to tell you, right? So as a parent for many years and having had 4 kids and now grandchildren and such, potty training, it is terrible. It is a challenge and it's not an easy thing. Teach the little ones that they have to let you know when they need to go, and then the things that you need to do. That is a mess. Now, how about this? How about if we have older people that live in our lives, so like grandparents, great grandparents, right? Who might have other physical problems, and part of some of their problems might be the lack of the ability to hold on to to choose a time when they can void or not. That's really tough stuff, man. I remember a sad thing I saw with my kids in the car, and we're in a downtown little town that we live in, and a gentleman came out of a bar, and he had messed himself. Well, you know, really sad, right? So he was like, when you're drunk, you lose this ability to hold on to and choose the time when to avoid. That's another situation that kind of sad stuff. He more than likely had many other health issues going on. But it's a controllable reflex, and it's something that has to be learned. And really, you have to be at a certain level of development as a child, right, in order to be at the stage where they can actively have conscious control over. Go ahead, please. Say again. Yeah. Yeah. Yes. You're absolutely correct. That so, and especially if a woman has had multi-gravidic, multiple pregnancies, right, over time. This can also affect your abilities and such, and so that has to be kind of like you have to do different Kegel exercises, different things in order to help with that. Yeah, most definitely. So like when you think about the sacrifices moms make in order to bring us out into the world, the pain, discomfort, and all the other added stuff that go on. You'll see here that there's a sphincter. Remember we talked about in the digestive system, sphincters are just smooth muscle. I can't control it, although there's an external sphincter for voiding as well as defecation that I can control, right? But sphincters, think of it primarily, it's smooth muscle, and you're looking at something you cannot control, and it's circular, and so it'll close up or open depending upon the situation that's needed. And so the smooth muscle is closed to help prevent the urine from flowing into the urethra. when it relaxes, as bladder tension increases, so there's more fluid in the balloon, in the urinary bladder, the bladder walls will contract and force the urine out. And so here, this next image here, what you're seeing is that you're seeing this structure, and just very similar to the stomach, in that there are these little folds, present within the stomach. There's also folds present within the urinary bladder, allowing for it to expand. Okay, so that's also very important and a big deal. So take a look at this model here of, this is the inner portion of the stomach. See how there's these folds present within? So those folds present within allow for your stomach to expand. Well, these are also present within the urinary bladder, allowing for it to expand, right? And once it expands, then it's sending messages to the nervous system saying, hey, oh, we need to relieve ourselves, we need to void, we need to urinate, we need to get this out. Now look at here, and you're going to see that we have the internal sphincter and the external sphincter right here and here. The internal and the external. The external sphincter, you control. That's skeletal muscle. The internal sphincter, that's smooth muscle. Write that down, please. The external sphincter, that's skeletal muscle, right? That's, you control skeletal muscle. The internal sphincter, that's smooth muscle. I have no control over that, okay? Working with them both, this is how we have the opportunity then to void, to urinate, to allow for urine to exit the body. All right, we're going to take a break. We'll take 15. When we come back, we'll finish up the chapter here. So folks of you that are online, I'm going to stop sharing. And I'm going to stop recording, and we'll resume recording.
This conference will now be recorded.
All right, folks, so we're going to be beginning, and we're going to be looking at a couple of short videos before I go back into the PowerPoint and finish that up. So I'm sharing this with you all. I'm going to close the door here. So folks, please don't fall asleep. I'm closing the lights, it makes it a little bit easier, but I think you'll find this interesting. So the first video that I'm playing for you all has to do with a patient living with kidney disease.
So I told the doctor, I'm like, my wife's unbeliever. He's like, okay, we're gonna get this week done. I told myself, you know, I'm having a baby now, I'm starting dialysis, which is like changes in my life, and I was concerned I was determined to handle it all at the same time. When my dad was diagnosed with PKD, they thought, aha, that might be what's causing this severe high blood pressure. So then they put me through a battery of tests. I was about age 29, and it was confirmed that I had polycystic kidney disease. And sadly, my son has it as well. We got married one Saturday, and on the following Monday, I had to go to the hospital to get the catheter put in. And the anesthetist said, I heard you got married on the weekend. I said, yeah, I did. And he goes, oh, welcome to your honeymoon. Yeah, he had a sense of humor, and after that, it wasn't too bad. We always wanted to have a family, and it was actually right before I got sick where we decided that we were going to start, trying to have a family. And then I got sick, and then we unfortunately had to put that on hold for a little bit, but everything kind of worked out the way it was supposed to work out. Not everybody at your workplace is going to understand that you have to go to doctor's visits every 6 weeks, and it doesn't just take half an hour or
or even an hour, it takes a while because you have to see a nurse, you have to see a doctor, and there's a dietitian, there's a social worker. They want to make sure that you're doing well, and you want to take care of yourself as well. If you don't have your health, you really don't have much.
You know, I mean, dialysis isn't a walk in the park. No matter which way you slice it, it's not fun. But frankly, the alternative is a whole lot worse. There's complications and there's issues with every type of dialysis, but you just have to roll with the punches. And if you get knocked off the horse, get right back on and ride and keep on going.
I would go to work. I would work pretty much the full day, and then 3 days a week I would do my dialysis, and then it would take me about an hour to come home. So I wouldn't be home until 11 o'clock, and you know, I wouldn't see my son. I wouldn't see my wife like 3 days a week. Basically, I would just come home and sleep, and then I would have to go to work again the next morning.
I really never saw it as a drawback. I'm a very positive person, so everything that I went through, it always had a positive spin to it. So, you know, I could get my feet wet. So I couldn't go into the water, but I could touch it and I could walk in it, but I couldn't swim in it, so that's okay.
In terms of my activities, I like to snowmobile. I do curl. I have to be careful not to fall on the ice. I cannot do any contact sports. That's definitely off the list.
I like to cook, and I think my interest in cooking has increased a lot more since my renal failure, because I can't just like go out and buy something from the store because I don't really know what's in it. So I have to make it at home, and I have to use alternatives. I feel like because of that, it gave me a new hobby. I think I would say stay focused on the good things in life, because there's still those good things that you have in your life are still there. They're not going away. They're still there, and there's more to come. You just have to make that adjustment.
I've met a lot of patients who are on every form of dialysis possible, patients who have had transplants, failed transplants, second transplants. I've met so many people, and the people who do well are the people who are determined to make the best of this. You know what? You can't change it. You got to live with it. So you try to live with it as best you can.
Honestly, I would encourage anybody that's on dialysis, if you want to travel, they make it so easy for you nowadays. It's amazing that you can just do about anything, and you never have to feel like just because I'm on dialysis, you're restricted. You're not.
It was a big life change, of course, but it wasn't as much of a change as I anticipated, because I was able to really work it into my life. I like to think of my dialysis as a little sandbox where it's just this little corner of my life, and it doesn't interfere with anything else that's going on. I do it when I need to, and that's it.
When my back was to the wall, I switched into high gear, and I have done anything and everything that they have asked me to do. And as a result, I mean, you know, my kidneys were supposed to fail 6 months, 8 months ago, and now they're thinking I still have another couple of years.
If you are diagnosed, don't think it's the end of your world. It's not. It's just a shift in your life. It's not all encompassing. There's so many people along the way that will help you. It's incredible. Instead of thinking negative, I would think positive, because it's not a bad experience. It's just a different experience.
We shut it down.
I like what was said there regarding it's not a bad experience, it's a different experience, right? So here's the thing that you have to think about when it comes to this, right? Is that whatever goes on in people's lives, right? And physical issues, illnesses and such, you all are doing the studies now, you're producing the papers. We realize that, you know, there are real people that suffer from these real diseases, these real disorders, these real illnesses. And how you come to deal with that is a big deal. And how you can see that those that do well, those are the ones that accept whatever it is that's coming their way and adapt, right? When you think of adaptation, right, in sciences and such, right? So if a species doesn't adapt, what happens to it? It becomes extinct. Understand? right? So that's the end all of lack of adapting. Well, in life, you all have to adapt. You all have all kinds of different things that go on in your life, and you have to make change. And that's just how it is, but that's just part of life. And sometimes it's an easy change, sometimes it's a hard change. But okay, you have to be able to be flexible and be able to be willing to make changes and such. And so you can, as far as those people who, and we're going to talk about what's going on here as far as what they mentioned in the latter part of the PowerPoint in a few minutes. But dialysis is a matter of that if your kidneys are not functioning like they should, then we're going to use external means in order to filter and remove waste products and put the blood back into your body so that this way you can still do the function of the kidneys, but it's not going to be optimal, but it's better than nothing at all. Because if your kidneys are failing or if they've failed and you do not receive kidney dialysis, you'll die. That's the bottom line with them. So it's a matter of that. There are different types of methods of dialysis, and we'll discuss that in a few minutes. But I want to do one more video, and that's on what goes on regarding the function of the kidneys, and then we'll get back to our PowerPoint and finish it up for the day. Yeah, we'll come back. This guy's pretty entertaining, so we'll watch some of this, maybe not all of it, but we'll watch some of it.
Eating, digesting, and metabolizing food. And those are some of my favorite things in the world. It's been a really great time. But as with all good parties or brunch buffets, in the end, we're left with a mess. And I'm not talking about spilled beer and Dorito crumbs. I'm talking about toxic levels of garbage that need to be cleaned up before they kill you. In your body, a lot of the cleanup that comes after metabolism is handled by the liver, which plays a tremendous role in directing dead cells and leftover chemicals to the digestive and urinary systems. But your liver can't actually escort waste out of your person. Your lungs can lend a hand exhaling carbon dioxide, and of course your colon will eventually poop out unusable stuff and old cell parts. But much of your chemical waste still needs to be sorted and disposed of, so one system steps in to bat cleanup, and that is your urinary system. This system, and specifically your kidneys, does all sorts of important homeostatic stuff like regulating your water volume, ion salt concentrations, and pH levels, and influencing your red blood cell production and blood pressure. But its main purpose, what we're going to be focusing on for the next 2 lessons, is how it filters toxic leftovers from your blood, like nitrogenous waste made by metabolizing protein, and ferries it out of the body. And spoiler, this all involves the how and the why and the what of your pee. Now, you probably know that kidneys are filters, and you may imagine them as sieves that strain out the bad stuff, leaving it sitting like a hairball at the bottom of the bathtub. But that is, in fact, kind of the opposite of what you should be thinking. Most of what's in your blood is totally removed by the kidneys. Then your body pulls back what it wants to hold on to before the rest is sent on a one-way trip to the bladder. It's kind of like, don't clean out your fridge by just taking out the rotten fruit and fuzzy leftovers. Instead, you got to take everything out and put it on the counter and then sort through what goes back into the fridge and what goes in the trash. That's how your urinary system cleans you up, and it is really good at its job. So this morning, I decided to go the healthy route, and instead of eating my normal breakfast of nothing, I had a big 32-ounce protein smoothie. My digestive system did its thing, and all the protein was hydrolyzed into amino acids, which were absorbed by my blood and sent all over my body to build and repair cells. It's a beautiful thing, but not without consequence, because metabolizing nutrients, especially protein, makes a mess. You may remember that amino acids are unique in that they have nitrogen in their amine groups, and because we can't store amino acids, extra ones get processed into storable carbs or fats. The amine group isn't used in those storage molecules, so it's converted to NH3, or ammonia, which happens to be toxic. So the liver converts the ammonia into a less toxic compound, urea, which our kidneys filter out into our pee. Once out of the body, urea can degrade back into ammonia, which is why dirty pee-soaked toilets and cat litter boxes smell like ammonia. Now, this business of taking out the nitrogenous trash is one of the urinary system's biggest jobs. Its other major duty is to regulate the balance of salt and water in your blood, and both of these tasks are processed in the whole system of tubes that is your urinary system. So let's take a look at some basic pee-making anatomy. Your kidneys are a pair of dark red, fist-sized, bean-shaped organs that sit on each side of your spine against the posterior body wall. Kidneys are retroperitoneal, which means they lie between the dorsal wall and the peritoneum, the membrane that surrounds the abdominal cavity, rather than inside the cavity itself, like your intestines and stomach. Each kidney has 3 distinct layers, beginning with the outermost cortex. Beneath that is the medulla, a set of cone-shaped masses of tissue that secrete urine into tiny sac-like tubules. And finally, the innermost layer is the renal pelvis, a funnel-shaped tube surrounded by smooth muscle that uses peristalsis to move urine out of the kidney into the ureter and into the bladder. Because the kidney's main job is to continuously filter blood, they end up seeing a lot of it. In fact, at any given moment, they hold over 20% of your total blood volume. Oxygenated blood enters the kidney through the large renal arteries, which deliver nearly a quarter of all blood pumped through the heart every minute. That means your kidneys filter about 120 to 140 liters of blood every day. As they enter the kidneys, renal arteries branch many, many times, ending in tons of little capillary groups. So a kidney isn't just one big filter. Instead, each one is made up of about 1 million twisty microscopic filtering units called nephrons. Structurally and functionally, nephrons are where the real business of blood processing, pee making, begins in 3 steps: filtration, reabsorption, and secretion. Each nephron consists of a round renal corpuscle that resides up in the cortex, followed by a long and winding renal tubule that loops around between the cortex and the medulla. The outer part of the corpuscle is a cup-shaped feature called the glomerular capsule, because inside it there's a whole tangle of capillaries called the glomerulus. That's from the Latin word for ball of yarn, which is pretty much what it looks like. And the endothelium of these capillaries is very porous, so they allow lots of fluid, waste products, ions, glucose, and amino acids to pass from the blood into the capsule. But they block out bigger molecules like blood cells and proteins, so they stay in the blood and exit through the peritubular capillaries, also known as the vasa recta. And all the stuff that gets squeezed out of the blood into the glomerulus is called filtrate, which is then sent along the elaborately twisting 3-centimeter long renal tubule. Even though it looks like just a tube, it actually has 3 major parts, some of which are permeable to certain substances, but not others. First is the proximal convoluted tubule, or PCT, which is about as convoluted looking as its name suggests. Then the tube drops into a dramatic hairpin turn called the nephron loop, or the loop of Henle, a term that I like better personally. And finally, it ends in the distal convoluted tubule, or DCT, which empties into a collecting duct. All this twisting might make the tubule look like super inefficient, but it actually serves an important purpose, as you might expect. Just like with your small intestines, the long, curly shape of the nephron provides more time and space for it to reabsorb whatever usable stuff it can. And this meandering path also allows the parts of the tubule that are toward the end to have an effect on processes that take place closer to the beginning as they pass each other. Because a lot of the stuff that winds up in the tube are valuable commodities, like ions and glucose and water. We don't want to just pee all of them out if we can help it. So let's trace the whole process, starting at the top with the proximal convoluted tubule, PCT. The walls here are made of cuboidal epithelial cells with big old mitochondria that make ATP to power pumps that pull lots of sodium ions from the filtrate using active transport. These cells also are covered in microvilli that increase their surface area and help reabsorb much of the good stuff from the filtrate back into the blood. The remaining filtrate passes from the PCT into the loop of Henle, which starts in the cortex and dips into the medulla before coming back into the cortex. And the form of this loop is key to its function, because its primary task is to drive the reabsorption of water by creating a salt concentration gradient in the tissue of the medulla. It does this mainly by actively pumping out salts in the ascending limb. This creates some very salty interstitial fluid in the medulla, so when new filtrate comes down the descending loop in front of it, water passively flows out and into the super salty interstitial space. Since most of this water is picked up by the blood pretty quickly, the saltiness of the interstitial space doesn't get diluted, so it can keep drawing water out of the next batch of filtrate in the descending limb. Needless to say, this is super important, because if we peed out all the water that went into our kidneys, we would die of dehydration quick. But even after all that, we are still only 2/3 of the way through the process. As we move out of the loop of Henle into the distal convoluted tubule and onto the collecting duct, the remaining filtrate is now officially urine. But there's one more component that we have to squeeze the most out of before we excrete the stuff: urea. Even though we think of urea as a waste product, just one more part of that protein shake that has to be dumped, the kidneys actually need it. They use it to ramp up the concentration gradient earlier in the process, making the medulla even saltier for the filtrate that's back there going through the ascending limbs. On the final steps, after the filtrate leaves the DCT, it enters the collecting duct, which runs back into the medulla. And while the salt passively draws even more water out of the collecting duct, some urea passively leaves the urine as well, making the medulla even more salty and in turn more effective at drawing out water from the ascending limb a few steps back. So there's a
Right. So we're going to exit out of that. I'm going to go back to the PowerPoint. And we'll talk about a couple of things that he just had mentioned. Okay, so let me bring this here. I'll turn on the lights in just a moment here. All right. So what he mentioned about and what he was talking about, which is quite interesting, is that the medullary region. So folks, look here in the class, right? So we have those areas where the triangles, right? Those pyramids, the triangles, that area is very salty. There's a lot of high salt content. And as such, water is going to be pulled out of those tubes and back into the body, okay? That's important, okay? So he had mentioned about how, let's see here, good, that there is that saltiness there, that's important. So it's quite interesting how the body does this as far as even at the end there, removing that urea, protein metabolism, processing proteins, and it's coming back. It's going to be relieved out of the body, but we're using it also to pull out the water out of the urine, out of the filtrate. So, all right, let's go back here, folks, and see. I'm going to share my screen. And let's get back to the PowerPoint. Here we go. So we'll start with this slide right here. A few more slides and we're done for the day, folks. Right here. Okay. All right. So what's interesting is that no matter what's going on as far as fluids entering in or leaving us, the kidneys help to maintain a balance of the total volume of body fluids can stay approximately the same. That's a big deal. That's important. Look here, this next slide. And what we're seeing, folks, is that this is the area, this is that loop part. That's the loop of the nephron. So here we have loop, right? And there's ducts, these collecting ducts, these tubes. They're going to take the urine. So things happen here in order to pull out that sodium and that chloride ions so that this way it can make it salty in that medullary part. That's this area right here where those pyramids are located, those triangles, right? That's the medulla, that's the inner part, and that's going to aid in the reabsorption of as much water as possible. And that's a big deal. You see here, there are two hormones. Antidiuretic hormone, ADH, and aldosterone. These are both working to hold on to water in the human body. Okay? So these hormones, antidiuretic hormone, aldosterone, will work towards holding on to water. So we would say that if a diuretic, I mentioned this earlier in the class here today, a diuretic helps us to produce more urine. An antidiuretic is going to hold on to, and we're going to not produce as much urine. We're going to hold on to the water. So if someone's out in the desert, right, are you going to sweat a lot when you're out in the desert? Well, initially you will, but then over time, in order for you not to totally dehydrate, your body's going to kick out more ADH, more of this antidiuretic hormone, to prevent you from losing water. So you're going to urinate a lot when you're out in the desert? No, you're not. You're going to hold on to that water. Aldosterone allows for your nephrons and your kidneys to hold on to sodium. This is also going to increase the amount of water that's held on by the body. In both cases, they're going to increase your blood pressure. Can there be pathologies? Can there be diseases that would cause you to have imbalance in this area? Sure, that could increase your blood pressure. We're going to see also that there are other areas and other issues that can go on that also contribute to this increase in blood pressure by holding on to the liquid. Now you'll see here in this next slide, you'll see here that this is where the ADH, that hormone, is affecting, and this is where that aldosterone is affecting. at the very end of the nephron, at the very end, that's where those two hormones are affecting, allowing you to hold on to the water, so reabsorbing more water. This next image here, you're just seeing how the nervous system, and in particular your hypothalamus, is going to be able to determine what's going on as far as, hey, you're not having as much water, right? You're becoming dehydrated and such, and so it's going to initiate also a thirst response. So you're going to feel thirsty, and you're going to want to drink in, take in more water. Feeling this dry mouth signals the body to drink. This next slide is showing you here in yellow. This is that capsule, that balloon that's covering the capillaries, that capillary bed, the glomerulus. And here's the beginning of the tubular network of the nephron. And so what you're seeing here is that on the right-hand side, it talks about different hormones that play a part, right? So receptors in the kidneys elsewhere detect full-length sodium levels. And what will happen is that there are certain blood pressure medications that will work on certain aspects of this chain in order to help a patient so that they're not having such high blood pressure. So there are receptor type medications that will block the chain from taking place and reabsorbing more sodium, which will increase the blood volume, which will increase blood pressure. pH. So the kidneys are actively involved in maintaining the body's pH levels. Okay, normal pH 7.3 to 7.5. So we say like 7.4 would be the average as far as pH is concerned of the blood. Too low, you're acidic. Too high, you're alkaline. Now, cancer cells thrive in a more acidic environment. Okay, so we don't want our overall body to have more of an acidic type pH. Okay, but this is so that's where we're at, more of an alkaline, more of this basic, we would say, term. Okay, so there are buffers that minimize pH changes, and so they can keep us at this 7.4, a little bit alkaline type of a pH. This next slide just shows us as far as what can happen as far as buffering and such, and maintaining that average pH of about 7.4, a little bit alkaline. So, and this is what goes on as far as what the nephrons will do. They'll either secrete more bicarbonate or they'll excrete it, right? So either we're holding on to the bicarbonate, allowing for it to buffer if we're too acidic to make it a little bit more closer to that 7.4, or if we're too basic, if the numbers are too high, greater than 7.4, we'll excrete the bicarbonate and will in turn lower the level of the pH. This is just giving you an idea as far as what's going on there. And this next slide here just talks about, showing you as far as what can happen with the bicarbonate and the buffering of the blood. So here we have acidosis, you're too acidic, or alkalosis, you're too basic, too alkaline. Both are not healthy or good. So there needs to be a balance. And that's why the kidneys are involved in maintaining this balance. Now we get to more pathology here, issues of an improperly functioning urinary system, kidney stones. Okay, so kidney stones, these are terrible, folks. I've experienced them, and it's not a fun thing to go through. And they can be as a result of different types of, in particular, calcium, but also uric acid. And uric acid is one that I produce that can actually block the flow of urine from the kidneys to the urinary bladder. And that's a problem. It can be very painful. You could have different procedures done in order to take care of these. We can determine as far as how many you do as far as preventing them. Well, so take a look at this right here, right? can they actually, let's look at, see the tube right here? They can actually block the tube. So it can actually block the tube, and this is going to the urinary bladder, or primarily it's looking at the area. But it can be filled with multiple stones. And so maybe there's a little bit of urine going through, but not all of it that should go through. And we can actually end up having the kidneys swell, and that's never a good thing. Yep, so blockage can reduce urine flow and cause kidney damage, and we have to take care of that right away. Next slide here is glomerular nephritis. So as a result of different changes in the body as far as high blood pressure and diabetes, we can damage the tiny capillaries present within the kidneys. This can lead to waste products, toxic waste products accumulate in the blood, and this can damage the kidney and its function. So you see their kidney dialysis can restore proper solute balance, meaning this particulate matter that is present, and the kidneys that are not functioning properly can use this dialysis method of filtration and removal of waste when the kidneys can't do it themselves. I want to show you an image. First, I'm going to show those online here. Let's see. So folks, this is a hemodialysis. This is filtering the blood with a externally. I want to show you all here on campus. So hemodialysis is when we're actually using a machine and we're connected to this machine, and maybe like 3 times per week, they're going in for a few hours at a time, like 3 to 4 hours, and it's filtering the blood and doing the role of your kidneys that your kidneys can't do. That's hemodialysis. We also have peritoneal dialysis. And this is where a patient will actually have, let's see here. So connected to their body, and they'll do this usually at night. We'll have a port, we'll have a tube that's connected to the inner part of the cavity that covers your abdominal organs. And so what'll occur is that, let me just show you all here, is that at night, while you're sleeping, there's a liquid that's going to be present within your abdomen and your peritoneal cavity. It's going to interact with your blood vessels and remove the waste. And then at the end, when you wake up in the morning, you'll drain this fluid from your abdomen, from your peritoneal cavity, and it'll go out and it'll be removed. And that did the role of filtering your blood that your kidneys could not do. Let me show you all online here. So folks, you see here, the fluid in your peritoneal cavity is filled with this dialysis solution. When you wake up in the morning, you'll remove it out of your body, and it'll be the waste that you'll be removing, doing the same job that your kidneys should be doing. A couple more slides and we're done for the day. So you saw a gentleman in that video there with learning how to live with kidney disease, and he said that he had PKD, polycystic kidney disease. So these are cysts, fluid-filled cysts, right, that replace the healthy tissue that's present within your kidneys that should be filtering the blood, producing the urine. Well, these cysts end up forming, and look at what happens, folks. Take a look at this image here now. What you're seeing here is that this kidney, instead of nice and smooth, it's full of all of these cysts. And this leads to kidneys end up not functioning right, and they'll end up stop functioning totally, stop filtering blood, and you need to transplant for dialysis in order to stay alive. So this is a really bad type of disease. And here, this image here is showing you whether it's hemodialysis or peritoneal dialysis, two different types of dialysis methods used in order to filtrate the blood when your kidneys are no longer functioning and working well. I want to show you something also here. So let me show you online here. Let's see, right here. Yeah, look at this. So folks, see how large the polycystic kidney in comparison to a regular kidney? I want to show you that here on campus, the difference between a polycystic kidney and a healthy kidney. So not only do they look kind of weird, here we go. This is a healthy kidney. This is an unhealthy kidney with that polycystic disease. It's like the size of a football. So normally your kidneys are about the size of a fist, about the size of a football that they can increase in size. And just because they're bigger doesn't mean they do the job. No, they have no ability to do what they need to do. Just again, another comparison. Very big and lack of function. All right, only a couple more slides and we're done. So this tumor, Wilms tumor, this is something that can occur as far as for the urinary system, type of kidney cancer, most common childhood cancer, so it's a terrible one. UTIs, urinary tract infection. Women are more susceptible. Why would that be? Because of the fact that the urethra for the female is closer to the body, and so it will then be more susceptible to an interaction between as far as what would come from the anus, right, to the urethra. And so that's why we teach young ones, right, to how to properly clean themselves in order to prevent urinary tract infections. But it's still as a result of intercourse and different things that patients can go through, they can end up coming down with urinary tract infections, even when being safe and protected. And so, nephritis. So anytime we see the suffix itis, it means an infection. Inflammation as a result of an infection. So bacterial infections are quite commonly the most common etiology for a nephritis, an inflammation of the kidneys. Know that you'll see here on the bottom, this is really important. So highlight this please for me in your notes, okay? Here it says acetaminophen, ibuprofen, circle them. Acetaminophen is like Tylenol, okay? So Tylenol, ibuprofen, so like Motrin, right? That'd be an example of Advil. These pain relievers, these painkillers, if we abuse them, if we take too much of them, they can lead to damaging and ruining your kidneys. And people every year have to go on dialysis because they abuse these painkillers. And these are over-the-counter painkillers. You can buy them at the grocery store, at the dollar store, I mean, right? You can get them anywhere. But if you abuse them, it's not going to be a positive or good thing. Just because they're over-the-counter doesn't mean they're safe for you. Use them when you need them, but don't overuse them and abuse them. And last couple of slides here, just looking at as far as the homeostasis, that maintaining of a balance within the body. The kidneys are doing this as far as working with the fluid levels, removing the waste products, right? This last slide here, Now, I just looked it up today before while we were on break. At present, we're over. So this is a couple, 2016. At present, 2022, we have over 100,000 people on the transplant list here in the United States. Over 5,000 more than what this was back in 2016. Crazy stuff, folks. And you know what? It's not a big deal if it's not you, but man, if you're the person that's dealing with these issues, or you have a relative that's dealing with these issues, it can be quite a challenge. So kidneys play a vital role in maintaining homeostasis and keeping us healthy and well. All right, very good. Okay, class, I'm going to stop with the recording.